let me tell you, this is not only about washing hands of employees, it is helping employees to bring this message home. As part of the business continuity plan, businesses should check whether their staff are working in open spaces and whether these open spaces are very close, very tight. And so that may involve increasing teleworking and having people potentially coming in different shifts to work. I hope platforms for virtual meetings will flourish and potentially will become, thanks to this outbreak, one of the silver lining of this.
In a situation like this, it's totally normal to feel sad, scared, angry, even a little confused. Ask questions, get your information from reliable sources, and educate yourself. Protect yourself and others. Wash your hands, don't touch your face, and don't share food and drink. Be a leader by sharing what you know and modeling good practices like coughing or sneezing into your elbow. And don't tease anyone about being sick. And if you feel sick or worried, tell someone you know that you trust. Have questions? Tell us in the comments.
If you feel unwell, stay at home and call your doctor. She or he will ask questions about your symptoms, where you have been and who you have had contact with. This will help to make sure you get the right advice, are directed to the right hospital, and will prevent you from infecting others. If you are sick, stay at home and eat and sleep separately from your family. Use different utensils and cutlery to eat. If you develop shortness of breath, call your doctor and seek care immediately. Like and share information for a better world.
While it's intuitive that you might need a mask, if everyone does that and we have masks in places where they're not needed, it might be the case, and frankly, it looks like it could be the case, that there won't be masks available in places where they're needed most. And we could have frontline healthcare workers responding to COVID and not protected themselves. And as long as that's the case, COVID will continue to spread in places where it could otherwise have been suppressed. And as long as COVID is spreading anywhere, it's an international concern for all of us.
You should buy a mask if you're a doctor or a nurse taking care of people that are affected by coronavirus, or if you are sick yourself. If you are in the general public, really buying a mask doesn't make a difference, and you should not buy it because you will take away masks that are important to have in hospital settings. What you need to do is wash your hands. Make sure that you do it many times during the day, and make sure that you help your children, your relatives to do it very, very often. Wash your hands always. 20 seconds, sing happy birthdays 2 times, wash your hands.
In these days, coronavirus is spreading around the world. 요새 신종 코로나 바이러스가 유행하고 있죠? In times like this, what should we do? 이런 때는 우리가 어떻게 해야 할까요? First, always wear a mask. 항상 마스크를 착용하세요. Second, wash your hands often and use hand sanitizer. 손을 자주 씻으시고 손 세정제를 사용하세요. I hope you guys are always healthy and happy.
Short answer, probably not. So unless you are caring for someone who is sick and coughing and has a fever, or unless you yourself are sick and coughing and have a fever, in which case you should be staying home, you do not need a mask. Please leave masks for people like doctors and nurses who are working around the clock to save lives. They really need them.
Based on the available evidence, the COVID-19 virus is transmitted between people through close contact and droplets, not by airborne transmission. The most effective preventive measures in the community include performing hand hygiene frequently with an alcohol-based hand rub if your hands are not visibly dirty, or with soap and water if your hands are dirty. Avoiding touching your eyes, nose and mouth. Practicing respiratory hygiene by coughing or sneezing into a bent elbow or tissue and then immediately disposing of the tissue. Wearing a medical mask if you have a respiratory symptoms and performing an hygiene after disposing the mask. Maintaining social distance, a minimum of 1 meter from individuals with respiratory symptoms. Thank you so much for watching this broadcast and see you again soon. Bye bye. previous broadcast, we all knew the information about where the coronavirus originated and how it transmits to the community. And now, let's find out about the group mode at risk, treatment and symptoms. Group mode at risk. People most at risk of infection from the novel coronavirus are those who in close contact with animals, such as live animal market workers, or those who are carrying people infected with the viruses, such as family members or healthcare workers. Symptoms. What is known so far, there can be a number of symptoms ranging from mild to severe. There can be a fever and respiratory viruses such as coughing, shortness of breath. In more severe cases, there's pneumonia, kidney failure, and death. The mortality is not known yet. Treatment. There is no specific medication for the virus, and treatment is supportive care. There are also no vaccine to protect against the virus. Treatment and vaccines are in development. In the next broadcast, we will learn about ways to protect ourselves from coronavirus infection. Please look forward to it. Thank you.
I totally figured out the coronavirus today. The technical name for the coronavirus is the COVID-19. COVID spelled backwards is D-I-V-O-C. D is the fourth letter of the alphabet. I-V in Roman numerals is 4. O is a 0. That doesn't matter. C is the third letter of the alphabet. 4 plus 4 is 8, plus 3 equals 11. Now we can't forget this is the coronavirus. Coronas come in packs of 12. 11 plus 12 is 23, 23, 19. You know what that means.
2319! We have a 2319! Red alert! Red alert! Red alert!
Just washing my hands so I don't get coronavirus.